people get nervous when you get told, like, who are you? Like, I love podcasts, crime podcasts, horseback ride, especially in Dubai, Hindi and Urdu are working out. Perfect. Tried to go to child and youth counseling because my mom's a child psychiatrist. Burnt out, didn't like it. Tried to do aviation. So I tried to be a pilot. So I was crew for a bit because my dad's a pilot. So I tried to follow my parents' footsteps. Didn't work. Water is toxic. Too much air is toxic, right? So it's, how do I say, you don't get that much from toothpaste that protects. It's good bacteria, right? But after that, it turns to bad bacteria. So then it starts attacking you. I love the idea of hygiene being preventative. I think everybody says this. I love helping people, It really is about that. It really is about giving people, smile matters. A healthy smile matters. They think we're just cleaners.
Yeah.
Right? And that's not what we are. So we're preventative measure, and there's so much in depth behind it. There's, how do I say it? Dentists really don't like us so much. We are preventative and they are treatment providers, right? So if there's nothing to treat, we prevented it, right? There's a little bit of a clash there, right? So, especially in the Arab world, are not very aware of it.
That's true.
So did you know what a hygienist was before you met me?
Especially they're having a huge exposure to many countries. They started in Canada, to Germany, to Switzerland, to the UAE.
It got a bit weird in the beginning because I didn't know how to cope with that. And then I realized the best way is to educate people on the importance of it and making awareness. And people don't understand that the bacteria has so many other systemic colorations between your body, right? We try to educate a lot of our patients as well. I don't feel anything. I don't have no pain. No. And I say education is key. I'm funny.
Funny?
Yeah.
Wow.
I'm approachable.
Okay.
Because when you walk into my room, I make sure that formality is gone. Because I try to right away make you feel comfortable.
Hi everyone, this is Noor, and today we're having a very special guest. Hi.
Hi guys, I'm Maria. I'm a dental hygienist and I'm from Canada.
All right. So stepping away for a moment from the clinic and the industry, what's truly in your mind today?
Right now?
Right now.
Coffee.
Coffee.
It's really early in the morning, so I would want a coffee. Yeah, I already had one, but another one. And you?
I'm pretty good. I got my coffee, so I'm
There
lucky
you
enough.
go. Okay, not bad.
So stepping away from that's the same thing,
Yeah.
but let's try to get out of the clinic and the industry.
Okay.
Who you really are.
Who am I?
Yeah.
It's such a weird question when people ask that. I hate
Really?
talking about myself.
You want me to be more specific about it?
No.
All right.
I mean, like, it's about, people get nervous when you get told, like, who are you? Like, you don't really think about that. You are who you are. Do you want to know what I do outside of work, aside from dentistry? I horseback ride. I love podcasts. Crime podcasts. Like, I'm a crime junkie. I love it. So I listen to it 24/7. I know people think it's a bit psychotic, but no, it's actually calming and soothing. It's like my therapy. So when I leave work, I'm listening to a podcast. When I'm coming to work, I'm listening to a podcast.
Real stories, not fantasy.
No. They're a crime. Like, really, like, all the stuff that's happened in Australia and Canada and stuff like that. Things I don't know about. And you never know. There's some things you actually learn from these podcasts. Like, there's so much things you learn, and you're like, wow, really? Like that, like. You wouldn't think it's connected. Yeah, exactly. I don't listen to it just because it's crime, but I mean, there's so much in there that you learn as to what happened, how it happened, and you kind of face the reality that life's just not perfect, that things do happen, but I enjoy it.
Yeah. So what made you choose dental hygiene as your specialty?
I chose hygiene. Okay, well, my background's little bit different. So I tried to go to child and youth counseling, because my mom's a child psychiatrist, and burnt out, didn't like it. Then I tried to do aviation. So I tried to be a pilot. So I was crew for a bit because my dad's a pilot. So I tried to follow my parents' footsteps. Didn't work. My sister's in hygiene as well, and she's one of my biggest role models. And I look up to her a lot. So she's in Switzerland. And then she's a hygienist there. So I kind of seen, I'm like, oh, she's doing really good for herself. And let me try it, right? Because I was a bit lost. And when I went into it, I loved it. I love the idea of hygiene being a preventative measure of dentistry, not a treatment measure. Because I think everybody says this. I love helping people, It really is about that. It really is about giving people, you know, because a smile matters. True. A healthy smile matters. And I think I found joy in the aftermath of what I made the teeth look like, because people just think a hygienist is just like a cleaner.
Well, exactly. That was about to be my question. Literally.
Yeah, sorry.
Yeah.
But that's what it is. It's like they think we're just cleaners.
Yeah.
Right? And that's not what we are. So we're preventative measure, and there's so much in depth behind it. There's, you know, we take care of the bone structure that actually is holding your teeth. So how do I say it? Dentists really don't like us so much. Right?
For the reason that you're preventing
yes.
the infection from happening.
Basically, like, yeah, because we are preventative and they are treatment providers, right? So if there's nothing to treat, because we prevented it, right? There's a little bit of a clash there, right? So I'm joking. No, we work wonderfully together. Of course, there's always going to be patients, right? But I think hygiene, people, especially in the Arab world, are not very aware of it.
That's true.
So did you know what a hygienist was before you met me?
Never. Not even before this podcast, let's say. So, yeah. So since you're saying that it's not something in the Arab world, that's really something, because I've been raised in Egypt my whole entire life, I've been living in Alexandria, and I've never heard about this terminology. Since I was living in a home full of medical field
really?
Literally, my brother, my dad, my uncle, all of them are doctors, not dentists, but they're in the same field, like in a way.
Dentists are doctors.
Yeah, not doctors, not dentists.
Exactly.
So the thing is, like, I've never heard my whole life about this terminology. So I guess that's really something, especially that you're having a huge exposure to many countries. You started in Canada, to Germany, to Switzerland, to the UAE now. So as per...
Well, yes. You know what's funny is because before I came into Dubai to work, I did not know we were not known about. Right? So it's
that's
like,
the point, yeah.
You know what I mean? Because I worked in Canada, I've worked in Germany, I've worked in Switzerland, and you know, it's a huge profession, right? It's over 100, I would say 60 years old. So it's a massive profession. So when I came here and I was like, every time they're like, what are you? And I'm like, I'm a dental hygienist. And they're like,
what does it mean?
What is that?
Yeah.
And I'm like, dental hygienist. It's like, it's in the name, right?
Yeah,
so it got a bit weird in the beginning because I didn't know how to cope with that. And then I realized the best way is to educate people on the importance of it and making awareness and how well we work. Like, we don't work for a dentist, we work with the dentist, right? We create treatment plans and especially for patients, meeting friends, you know, anybody. You just want to be able to explain what we do and why it's important. Our profession wouldn't be there if it wasn't needed.
If it wasn't needed, exactly.
Right?
That's true.
So there wouldn't be a university everywhere, you know, to study something that there's nothing to study, right?
True.
So, and I understood that the only university close to here is in Saudi, right?
Which is like a different country, not even the same.
But it's the Middle East, so it's happening, it's coming, right? Coming. The awareness is there. I met a few of hygienists from Saudi Arabia because we have some program that I'm involved with here. It's not internship. So there's a few programs I'm involved here in Dubai, and you get to meet people that all the hygienists, we kind of come together, we're in a group, we talk, we support each other. So that's one thing I really wanted to talk about, is to showcase what we do, why we're important. And, you know, a dentist looks mostly like, okay, they look at everything, but they mostly look at the tooth.
Yeah. From outside. Let's say.
Whether it needs a filling because there's a cavity, or the roots are not healthy, or it needs a crown or veneers, where we mostly look at first what's holding the tooth, the bone structure, you know, the pocket depths, and trying to keep that healthy so the patient has teeth.
Yeah, I got it.
Right? So,
I got it.
So the dentist can work with it. Of course, we look at that as well, but we're mostly just to keep the bacteria level low. And people don't understand that the bacteria has so many other systemic colorations between your body, right? So we try to educate a lot of our patients as well.
If you're, for example, treating someone with a problem, for example, he's diabetes or diabetic.
So no, we do see diabetic patients. We see, the thing is, you see everybody. You see patients from hepatitis, you know, B, C. You see patients who have HIV.
Yeah.
There's a lot of measures you take.
A question, since you mentioned HIV, is it being a hygienist is preventing all the infections that could happen by oral from the oral, like starting from the oral, or it's just about the dental problems?
No, like HIV patients, some can get it through birth. So the way they get it, we don't really ask. No, dentistry has nothing to do with preventing HIV. But it's to keep the patient healthy. But that's to do with, there's cardiovascular issues, respiratory issues, right? People understand depression is a part of it, dementia is a part of it.
Yeah, of course.
Anything you could think about, like Alzheimer's is a part of it.
I got it.
So the bacteria that you have in your oral cavity, it does add you to get something. You're more prone to get something than if you have a good balance and a good oral hygiene.
So could you say that the COVID-19, for example, has promoted being a hygienist in the Middle East, since it became something to prevent things from happening if it's like by any means?
No, I don't think so.
It has done nothing with that, right?
No. COVID-19 is a respiratory virus, and it was a very dangerous time for us hygienists and dentists to work, because actually we were the first line of defense. You can't, all health workers had to work. So everybody was at home, but the doctors and, anybody in the medical field, we were at work. And especially you're in the oral cavity, and that's aerosols, bacteria, all around you. And you have the closest thing of catching COVID-19, right? But I worked. I was in Switzerland when COVID happened, and it was a normal life. You just had to have your PPE and go to work, because what? The patients matter, pain mattered.
Definitely.
And, like, you couldn't stop. You didn't have a choice, like where other people got, to stay home.
I got it.